get something I want me we talk about today. Now something where most people, if the population na 100, 95% of the population dey suffer from this condition wey dey call ulcer. So I go like make we talk about ulcer. First of all, ulcer, wetin be ulcer? Ulcer na sore, na wound wey dey form for the inside the lining of the small intestine. The lining of the intestine, you know how inside, if you open your mouth, if you open mouth like this, use mirror open your mouth, for this side of your mouth, that tissue, that soft part of the skin wey dey there, that mucosa, na so e dey for inside the intestine. They call am the lining of the small intestine. So once you don get wound or sore, that wound or sore, we dey refer to am as ulcer. You understand? So wetin dey cause this ulcer now, wetin dey cause this wound? E dey either be bacteria or something else. Now the bacteria now fit be, they dey call the bacteria H. pylori. You understand? Na the name wey they dey call this bacteria. Now e fit be say na im dey cause the wound, or e fit be say na excess consumption of painkiller. Any small thing wey do you, you go take painkiller. Any small thing, you go drink painkiller. Another thing be say stress. Now this stress now, e go fall under when the wound don dey there. E go make am severe. Na so I go take put am for you. Emotional imbalance too dey also be one of the cause. Once you dey stressed or you dey emotional imbalanced, e dey also cause this ulcer. Now e go only cause this ulcer in the sense wey be say the wound don dey there, e go come aggravate, e go come worsen the wound now. Understand? So I know say e get one part wey everybody dey always dread. We go soon reach that part. If you go stick on, you go hear, and solution dey for that part. So make we just stick on dey go first. Now make we talk about the symptoms of this ulcer. How you go take know say you get ulcer? Number one, if you dey get burning stomach pain, wey be say if you just dey, your stomach go just dey pain you, dey be like say fire dey catch for inside your stomach, na one of the symptoms say you don dey get ulcer. Another one be say bloatedness. Any small thing wey you eat, your belle go just swell up. Any small thing wey you just chop, you drink water, you eat buns, you chop, belle go swell. Na im dey call bloatedness or bloating. E dey show say yes, you don be like say you don dey get ulcer, or you don get ulcer. And that one na loss of appetite. You no go fit chop. Nothing wey you go see go hungry. You go just be like, if you just dey, your stomach go full. You never chop since morning o, but your stomach don dey filled up already. Na another symptom say I don get ulcer. Indigestion. If you chop, food no go digest, e go dey hang for your chest. E go dey make you like say you wan throw up. You dey get nausea. And that one be say nausea follow. Nausea and vomiting. Sometimes the vomiting dey accompany blood. You go dey vomit blood. Na one of the symptoms. This one na the most common symptoms say person don dey get ulcer, or say person don already get the ulcer. Now types of ulcer. Most people no know say ulcer get types. E get one wey dey call peptic ulcer. E get the one wey dey call duodenum ulcer. E get the one wey dey call gastric ulcer. Now this peptic ulcer now dey affect your stomach. Na for stomach na peptic ulcer dey affect. Duodenum ulcer dey affect the intestine. The gap in between the stomach and where the intestine dey start from, they call am duodenum. So from that place now to the small intestine, because na inside, na that, in fact, the intestine wey connect direct to the stomach, they call am the small intestine. So the gap wey hold am, understand, wey could join the two of them, na im be duodenum. Now from there now, all the wound go start from, they call am duodenum ulcer. Na im dey affect the small intestine. And now they call am gastric ulcer. This gastric ulcer now dey affect your chest. You know, be say your chest go dey burn you. And that one they call gastric ulcer. How you go take treat this gastric ulcer now? They treat am through medication. You go take medication wey dey reduce stomach acid, and antibiotic wey go help eliminate that bacteria wey they call H. pylori. In case you get am, in case you get H. pylori, no be for if you no get am o. If you get am, because I say na one of the common cause, no be say na im be the only cause. If it be say na one of the common cause, so if e dey for your body, you go need take antibiotic as well. And no be say you go self-prescribe yourself. I don warn una before for one of our topic wey we don discuss. Self-prescribed medication no good. Once you don feel one thing or the other wey no good for your body, try go meet your pharmacist or your doctor. Na dem go prescribe for you. no prescribe for yourself. Another one na change of lifestyle. In case na medication like pain medication na im dey cause am, dem dey call those kind pain medication NSAIDs, non-steroidal anti-inflammatory drugs, na im be NSAIDs. NSAIDs, example of dis NSAIDs now na diclofenac, ibuprofen, you get. So if na all dis kind of medication na im cause your own ulcer, you go need to either change am or you stop am, and you go only change am when you don go meet your pharmacist or your doctor, complain say see wetin dey do me, and e go ask you questions say okay, you dey take pain medication, which type you dey take, because dem get, if na diclofenac, dey get sodium and potassium, and e get the one wey good for people wey dey take ulcer and the one wey no good. They go place you on the right medications wey you go continue to dey take in case you need to change, in case na something wey you need pain medication but no be the right one you dey take. Many things wey we no even know say most of these fruits wey dey around us, herbs, natural things, dey actually help reduce pain. Turmeric dey help for pain, so no be everything wey any pain wey we get wey we go just jump go dey take pain medication. Make we try look for natural sources wey we go take dey help ourselves dey reduce pain, like turmeric. Turmeric dey really help dey reduce pain for body. Now make we talk about wetin people wey dey suffer for ulcer suppose dey abstain from. Na dis part na im most people dey dread. They no wan use ear hear say they say make I no chop dis one o, they say make I no chop dis one. If we no chop am na wetin we go come chop? Now make I go first of all mention the things wey you no suppose chop, then I go tell you wetin I suppose tell you, which everybody suppose know about. First of all, you no suppose to dey take anything wey contain acid, wey dey acidic, like tomatoes. Tomatoes in general dey very acidic. Whether raw tomatoes, anything wey be tomatoes itself, you no suppose dey take am, e dey acidic. Citrus fruit like pineapple, orange, grapefruit, you no suppose dey take am because e dey acidic as well. Spicy food na im be number 2 now. Spicy food like chili pepper and hot sauce, you suppose dey run anytime wey you hear that thing, anytime wey e dey for food wey you order. Ask them, madam, this your food dey spicy? If e dey spicy, omo, shift from that side. Another one na food wey dey high in fat. High in fat like raw meat or pastries. Pastries like buns, cake, make you try dey reduce am, make you try dey run from am, dey leave am, because e dey actually affect ulcer. Another one na food wey contain caffeine, or anything wey contain caffeine, like black tea, green tea, energy drinks. These things dem contain caffeine and e no good for your health. E no good for you wey dey suffer from ulcer. Alcohol, whether na beer o, abi na wine o, abi na spirit o, e no good for you. So far say you get ulcer, e no good. If not, e go make am severe and e go increase your stomach acid. Another one na carbonated drink like soda. I mean anything wey you open and you do shh, make you leave am, e no good for you. Reduce am, leave am. Even sparkling water, drink plain water. And then I hear say most people dey talk say instead of make we dey take all this carbonated drink, if you dey take milky drink dey good. I dey also wan tell you now say milk fit stimulate stomach acid. E fit stimulate your stomach, make e produce or increase the acid wey e dey produce. Milk fit increase am. Another thing na hot cocoa and chocolate milk. This one too fit increase stomach acid. Now one thing now wey everybody no know be say individual tolerance dey different. Say I fit take spicy food now as an ulcer patient and e no go disturb me, but another person go take am as an ulcer patient, e go disturb am. So individual tolerance dey different. I no talk say make you no chop food. You go chop, you understand, because na here everybody dey run from. You go chop, but your individual difference, everybody get individual tolerance. Some people dey lactose tolerant, some people no dey lactose tolerant. I fit take milk now, e no go disturb me, but another person fit take milk now, e go begin, everywhere go hot, things go begin happen. So you go check wetin your body like and wetin your body no like. You go come resist from the one wey your body no like and stick to the one wey your body like. At the same time, you go dey reduce the rate at which way you dey take am, make e for no harm your health at the later on. I hope say we don learn one or two from this thing now. For those wey stick to the end, thank you all and see you next time on Joy Talks Health.